delighted to be joined by Tobias Koesters, partner at L.E.K, who leads the European healthcare practice. Welcome to HBI.
Thank you.
So following the session you moderated today, in terms of care delivery, how can we redesign care around the patient in a way that benefits them, the health system, and drives value creation for investors as well?
Look, in general, patient-centered pathways are essential in managing specifically complex health conditions, but not just complex, also the easy stuff, right, can get lost in silos if you don't have an integrated pathways. Complex health conditions specifically, they require multidisciplinary longitudinal approaches. You don't just have that one episode in time where you can ideally identify everything that's wrong with the patient and treat it. But today, you only really have 1 out of 3 patients that really seek medical help when they have these episodes and know how to steer through the overall pathways. Right? So it's really important that we don't have a delay in delivering this care, and we don't have a worsening of symptoms of the patients. Half the patients who do need support, they suffer not just from a single condition, but from massive overall functional conditions. And these are clinically complex issues that impact the daily lives of the patients, and coordinated pathways can just be much better, much more efficient, not just for the provider, for the patient, but also for the system overall, by reducing overall cost. So traditionally, the burden of orchestrating the care pathways and identifying right specialists in the system have really been fallen into the hand of the patient, right? But the patient is no clinician and no clinical expert. So integrated pathways can help cutting through that.
Thank you, that makes sense. So looking at the outpatient market, what are kind of some of the biggest trends you're seeing right now, and what are you excited about for the future?
So I think we've seen at first in the outpatient sector, investors or entrepreneurs first consolidating within the therapeutic areas. I think that was sort of, let's call it the consolidation 1.0, where you can ensure that you have best practices being rolled out across a single therapeutic area. Then we've seen, coming from various angles, outpatient providers first starting to integrate diagnostic services, or diagnostic providers starting to integrate, forward integrate into the care delivery. I think that's sort of the second wave of roll-ups. And I think now we've started seeing over the last few years, driven again by a subset of truly entrepreneurial physicians, but also investor-backed or corporate-backed vehicles, that they're now starting to truly integrate along the patient pathways to ensure that the patient, who should always be in the center, gets the right treatment at the right point in time at the right location. And I think that's the abilities of these news roll-ups. I think I had fantastic panel participants who are all demonstrating that this is the most important in evolution of care, and we need to cut across settings and cut across silos of therapeutic areas to ensure that there is better care at a more attractive price point for the payer or the patient that pays out of pocket.
Definitely, thank you. It's a bit of a separate question, just to see if you do have any thoughts on it. Looking at pharma, where do you see retail pharma consolidating beyond its traditional services currently?
Coming from Germany, I probably have a very backward-looking view on how you can integrate retail pharmacies, because regulatory hurdles are just so difficult in the German market to overcome and integrate the market. But looking back 20 years, when MVZ was introduced in the outpatient sector, that was not possible either, and it took some entrepreneurs to cut through those barriers. I think other markets like the UK or France or Italy are further down the road, and you start seeing a consolidation of retail pharmacies. And I do think there is a benefit, and as we digitize also, the role of the pharmacist changes, right? with all the information can be at hand. You can have remote or tele pharmacies where you don't need a pharmacist physically on the ground, and it can just be way more efficient for all the service providers. I think obviously Amazon has done some pharmacy investments, specifically in the US, where my colleagues do a lot of work in this space. You've seen some integration on the compounding pharmacies, etc., less on the retail side, outside of the countries I mentioned earlier. But look, there are franchise concepts, there are co-branding concepts, etc., that are offering their services to the traditional pharmacists as well in regions like Germany or Central Eastern Europe. And I think they work well. And in that instance, the patient is a consumer. Yes, he gets scripts filled at a pharmacy, but a pharmacy is more than that. It's also a retail channel specifically for OTC products and other self-medication as well.
Great, some really useful insights. Thank you.
My pleasure.
Thanks.